series on public e-health in the Caribbean. At first, we looked at research focused on media on the 4th of March. Then on the 11th, we looked at practical examples of projects that existed in the region. And today we are going to look at policy and implementation, how to implement e-health and how to influence policy in the region in this regard. To view any of the previous webinars, you can access it at the ESAC project YouTube page. This morning I would like to welcome our presenters, Doane and Tomas Sandor, and I'd also like to welcome those representing the Pan American Health Organization, the University of Toronto, who are partners in implementing the ESAC project. And of course, I have to recognize our funder, the International Development Research Center, IDRC. Before I introduce the presenters a little bit further this morning, I'd like to invite Dr. Gladys Faber to bring greetings on behalf of the Pan American Health Organization.
Thank you, Soroya. Very happy to be here and to see the important audience we have today. I would like to give the warmest welcome to everybody, but in special to Mr. Doane and Dr. Tomas Sandor. Thank you so much for being with us. ESAC is a young project, but with a very promise perspective. So I would like to thanks for being part of our community and to start discussing key points related to policy in public health. Thank you, Soroya.
Thank you, Dr. Faber. I'd also like to invite Dr. Andrea Cortinoa, co-director of the ESAC project and representing the University of Toronto, to bring some brief greetings. Thank you.
Thank you very much, Soroya. It's a pleasure to be here with you this morning, and I hope you all enjoy the session. As you know, the project ESAC is a project that aims at supporting and nurturing an ongoing dialogue and reflection on the different ways in which information and communication technologies can be used in health in the Latin American and Caribbean region, beyond the most common uses in clinical and individual care, so moving broadly into the public health area and beyond that into the area of the social determinant of health. These webinars are part of that effort, and I hope they are a useful tool for many of you to perhaps learn something new, share your experiences, and identify useful contacts for future collaborations. Thank you so much.
Thank you, Dr. Cortino. Just to let everyone know that all the presentations will be in English this morning, and after both presentations, unfortunately, I don't think that Dr. Mendez-Davidson will be here this morning. However, after the two esteemed presenters that are present this morning, we will open up the floor to question and answer. So you'll be able to actually raise your hand, and I'll explain how to do that a little bit later. Or you can alternatively post questions in the chat. But we will save that for after both presenters have had a chance to speak. This session is being recorded, and after this session, we will upload the link to the YouTube page for ESAC. At this time, I would like to present, to introduce the first presenter. But before that, actually, I would like to do a brief polling exercise with the persons that are in the room. So if you look at the screen, there is a poll question: what region are you from? And In order to participate in the poll, the icon for poll is right under your name. Under participants, it is the little square with the A in it on the right-hand side of the hand symbol. So if you hover over it, you'll be able to click on whichever area, whether A, Caribbean, B, Central America, including Mexico, C, South America, D, North America, or E, Other. Just to explain again, the poll mechanism is right under your name. Under participants, then it has your name, then it has a smiley face, a little silhouette of a person, a hand symbol, and an A. So if you hover over the A, you'll be able to click where are you from. A, Caribbean, B, Central America, including Mexico, C, South America, and D, North America. I'm just giving a few persons who haven't had a chance yet to answer the poll question to participate in this get to know who is in the room exercise, and a couple of persons are just coming in. So I'm just going to repeat the instructions again. Right now, to those coming in, welcome. We are getting to know who is in the room with us, and so we're asking a poll question: which region are you from? Now, if you look in the left column, under participants, there should be your name, and under that, there are 4 little boxes. The box on the far right is an A, and if you hover over it, you'll be able to select A, B, C, D, or E. And reading the poll question again, which region are you from? A, Caribbean, B, Central America, including Mexico, C, South America, B, North America, and E, Other. Okay, I am seeing where most persons have answered the poll, and at this time, just in order for us to move on, I am going to lock the responses and just show you briefly what the response has been. So we have A, that's Caribbean, 17% from the Caribbean. B, 5% from Central America, including Mexico. C, 17%, that's South America. And 29% from North America. And actually, I would just like to recognize the CARPHA, the Caribbean Public Health Agency lab, which is really about 6 persons. So we would have had another 6 representing the Caribbean as well. But welcome to all, and thank you for being here this morning. We're just going to move on to introduce our first speaker, who is Mr. Daniel Doane. Daniel is a senior health information systems consultant with over 15 years experience in the strategic planning, implementation, and use of health information technologies in public health, primary care, and hospital-based settings, and has provided expertise to health organizations in Canada, Latin America, and the Caribbean. Daniel has facilitated the WHO Health Metric Network assessments for Turks and Caicos, Trinidad and Tobago, and as well as the National Health System and Information System strategies for the Commonwealth of the Bahamas. In 2012, he facilitated and drafted the National Health Information System Strengthening and eHealth Strengthening Strategic Plan for Jamaica. In 2011, Daniel developed a health information system strengthening framework for the Caribbean region for the Office of Caribbean Program Coordination, PAHO, and in 2012 drafted a toolkit to support the strengthening of national core health indicators. Daniel is a certified professional in health information management systems, and he is based in Toronto, Canada. So once again, I would just like to thank Mr. Doane for being here with us this morning and sharing his experience. We are really happy to have him. Thank you. Hello, Daniel, are you there? Mr. Doane, are you there?
Can you hear me? Let me try that again. Are you able to hear me now? Okay. Well, I guess you didn't hear the first part, so I'll start that again. Good morning, everyone. As I will look for any sound issues on my message. Thank you. I hear the good message. I see the messages coming up that you can hear me. That's great. I just wanted to thank the whole ESAC team for inviting me to speak this morning, and Soraya in particular for facilitating this process. I was very pleased to be asked to speak today, and I think it is very much in line with the theme that I want to talk about, which is the issue of collaboration within the sub-regions and regions of the LAC. In particular in terms of being able to support a more effective implementation of eHealth. Our focus today is really on the use of eHealth in the public health sphere, which is an area which I'm very interested and passionate about. But I want to also speak a little bit more broadly today about core foundational issues that certainly apply to public health, but it would apply anywhere that eHealth is used. Just make sure I know how to flip through my screens. Let me see. There we go. Perfect. So I'd like to talk a little bit of my overview of my presentation of really what I think are some of the core issues around and opportunities around collaboration and why I think that's important. I want to briefly talk about what are some of the key eHealth building blocks that every country really needs to address and put in place to be successful. And I'd like to go through each of those building blocks one by one and talk about what the real core need is in that area, where we are right now, and what some of those opportunities for regional or sub-regional collaboration might be. And then talk a little bit at the back end about how do we move some of these processes forward, and certainly would like to hear from you in terms of your ideas and feedback in terms of how collaboration might be better realized within the regions and sub-regions of the LAC. I want to begin my context in my presentation today to say that largely my experience has been within the Caribbean region, although recently I have been working with Guatemala as well, so certainly some of the patterns that I've seen within the region I think apply to Guatemala. I'm less familiar with the rest of the Latin American region, so certainly from the folks who represent those areas would be really interested in hearing whether some of my comments or my assessments are applicable in those countries as well. When we talk about eHealth, it's really important to realize that the successful implementation, adoption, and use of eHealth really requires effective mobilization of a number of significant financial, technology, and human resources. This is certainly an experience that we in North America and Canada have had over the past 15 to 20 years, and we have, I think, some spectacular failures to demonstrate what happens when you don't actually put all these building blocks in place and have the appropriate resources. So as countries in the LAC region begin to improve and deliver on eHealth, I think it's very important that these components are in place. And of course, getting these resources, and in more particular sustaining these resources, can be very, very challenging. To address some of these challenges, particularly in terms of resource-constrained countries, I think that regional or sub-regional collaboration and resource sharing is going to be a very effective strategy. And really what I'd like to focus on today is looking at where we sit in some of these particular areas, and then talk about what some of those opportunities for collaboration or resource sharing might be. The WHO, in its National eHealth Strategy Toolkit, I think has built a very nice, clear model for what they call the eHealth building blocks, or the key components that need to be in place and effective in order to support the implementation of eHealth across a particular country. At the top you see the core one, and I think you'll see it sits on top of all the other building blocks, is that of leadership and governance. And you'll see as I go through the presentation why that in fact is the case, is that without a really strong leadership and without a good, strong governance model and framework, the implementation of all these other components is very, very difficult, if not impossible. Clearly, you need to have a very a clear strategy and capacity to draw investment, whether that investment is coming from the public sector or through private sector partners. That middle box, those three boxes, really focus on the technology components of an eHealth system, including the actual services and applications that you need to deliver those particular functions. Very, very important are the issues of standards, and standards, of course, support interoperability between information systems, and finally, infrastructure, that being the hardware, the networks, the data centers that provide the core backbone, if you will, of an eHealth system. Alongside that, then, is the issue of legislation, policy, and very importantly, compliance. So having the correct regulatory, legal, and policy framework in place that's going to enable and also support and ensure that eHealth standards, practices, and quality measures are upheld. And finally, there's the issue of the workforce or the human resource side of it, again, very important, and particularly challenging as the area of eHealth really does require some specialized skill sets and experience that are not always readily available in the region. This first slide, then, I really want to speak a little bit about the issue of leadership and governance, as well, actually, as this section slide here on strategy, second box here on strategy and investment. When we talk about what we need in that area, Carrie, what we have to first of all have is a very singular and shared vision about what eHealth means in our particular country. I think this is very important as well for folks who are focused on public health, because as is often the case, eHealth and the focus of eHealth tends to be on the clinical side. So for us as public health practitioners or working in the field, it's very important that the vision of the public health vision and how eHealth will support that is included in any kind of vision and strategic planning exercise. The issue or the capacity to do effective collaboration and communication. eHealth involves many, many different stakeholders within a particular country, within a sub-region or region. And without having a very effective coordination body that has the mandate to make decisions as well as to draw people to the table, it's very, very difficult to unfold a system. We need leaders and champions for change, and particularly from the clinical side, but also from again, from the public health practitioner side, and from all levels and all stakeholders. And the implementation of eHealth really drives change, and without good leadership and champions for that, it's impossible to do. And we also need to be able to bring and foster that kind of investment that's required and establish and support standards that are going to lead to interoperability and good quality data and information. So where do we stand right now in some of those areas? Most countries or many countries have begun to implement national eHealth or national health information system steering committees. In the cases that I've been involved with, for the most part, I see those as being very public sector focused at this point in time, with a less involvement or support from the private sector, which, depending again on the health systems in different countries, can be a challenge. As well as when we talk about the public sector, we also need to be thinking about the ICT sector, particularly the telecom sector that can help support the backbones. And so we're not quite there yet, I think, in many countries within the region, in terms of making sure all those players are at the table, or that we have a fully effective governance body that has actually the mandate and the legitimacy to be able to drive and coordinate eHealth activities at a national level. Certainly at a regional and sub-regional level, the governance around eHealth in particular seems to be a bit ad hoc. It tends to be project focused, or it tends to be within technical bodies such as this, for instance, and there really is a lack of a strong formal eHealth driving governance body that can make decisions. There are eHealth related decisions that are enfolded into some of the other governance bodies, but those tend to get a bit short shrift because of the other topics and demands that might be at the table. Certainly, I think one of the challenges is that we have coordination, but perhaps ad hoc coordination with some of the international agencies and NGOs that are interested in supporting the development of eHealth in the region, and I think that area can be certainly improved. PAHO, through the Caribbean Program Coordination Office, has developed, as I mentioned at the beginning, a framework for a regional or sub-regional strategic plan, looking at how this can develop. So we are beginning to see the emergence of a strategy at that level. Many countries now have also begun to develop their own national strategies. Jamaica certainly I've been involved with, Bahamas I've been involved with, Trinidad and Tobago I know is moving toward and have in place a strategy as well. Other countries are still in the development stage. In terms of opportunities then, really I think there's an opportunity from a collaborator perspective to develop a governance model and a set of tools that help at a national level really strengthen that coordination capacity. Again, we don't need to reinvent the wheel. I think there's models that work in terms of who should be at the table, the types of decision making that need to be made, and the lines of authority for those organizations. And I think those can be developed and replicated in a way that helps countries quickly strengthen their national coordination capacity. I think it's going to be very important to help develop leadership in the region and build those regions. I think we really see, it's very exciting to me now to see a number of leaders in a number of countries who have very deep experience and a very strong vision. And I think we need to continue to develop that. We have a role, I think, for a regional or sub-regional governance body to help coordinate some of the required investment and support particularly from ICT and other kinds of private entities that are going to have to be clearly involved in the development of the infrastructure areas. And to be able to establish and enforce some of those standards at a regional level, so that in fact we can get to the point of interoperability and sharing information as well as systems across these sub-regions, and then to be able to actually formalize and enforce a plan or strategy that can be coordinated at the regional or sub-regional level. Standards and interoperability are very core to the capacity to be able to, of course, exchange information and to make sure that systems can actually speak to one another and that we don't end up with sort of siloed environments. Again, I think very important for public health is sometimes seen as a side to the clinical aspects of eHealth, but understanding and building tools that can allow data to move across those environments, as well as allowing shared information systems is going to be very critical. Similarly, the development of IT standards and architectures to support that interoperability is going to be important, so that is the development of standards for platforms, for messaging, for security, things like that. Currently, certainly we do have standards that are working in the region. Obviously, PAHO has established standards for health indicators. I think we still have challenges with coordination of those health indicator standards with other international organizations. Everyone, and certainly from a programmatic area, can develop and build health indicator standards, and that can be sometimes burdensome on countries who are trying to meet different standards or different needs. But I definitely have seen an improvement of that over the years. Certainly ICD-10 for morbidity and mortality coding is widely used. Many countries now have begun to build their own national data standards and are building data dictionaries to represent or to document those standards. So, that's happening in Barbados, and it's on the plan and timeline for Jamaica. And Trinidad and Tobago has also embarked on that kind of an exercise. Very challenging, again, in order to sustain that if you don't have the right resources. But those standards are important to be able to ensure that as we bring on new systems, that again, we're able to have communication and interoperability between those systems. I don't think very many countries that I've worked with have formally established national IT standards internally in terms of adherence to platform standards, messaging standards, communication standards. I think those are still emergent, and I have not yet really seen any I would call regional or sub-regional IT-based standards at this point in time. So I think some of the opportunities here are clearly, I think particularly around the issue of data standards, is to begin to look at developing at a sub-regional and regional level a common data standard for health information, and particularly health information in this context in the public health area, which again sometimes gets short shrift for from those who are leading these initiatives. There are certainly international standards that can be adapted from. I think that there needs to be regional adaptation to these standards to make sure they make sense in the regional and sub-regional context. And I think we have to recognize that countries will have their own flavors as well. So I don't think this is always about making sure everyone abandons what they want to work on in order to meet a regional or sub-regional standard. There can be adaptations that can be accounted for or accommodated, but at a baseline, it's a very important issue to be able to have a standard set of data standards in order to be able to really facilitate that interoperability. Certainly there are a host of international standards that countries really need to be able to formally adopt as part of their policy and their technology frameworks. Certainly ones like HL7, Snowbend, LOINC from a lab standards, there are security standards, and there are standards for developing other kinds of metadata that are freely available internationally and make sense for countries to participate in and buy on in a formal way. So in terms of services and applications and infrastructure, of course, these are the tools that we are always most often focusing on and get a lot of attention from an eHealth perspective. That is things like the applications we're using, whether that be mobile health or telehealth. In the case of public health, it can also involve things like surveillance and case management. It might involve things like e-learning and certainly social media. So one of the challenges that we see is, of course, there are many applications out there that can support various aspects of eHealth, and it can be overwhelming for countries to figure out which system is the most appropriate for them and to be able to invest in those systems. We also need to think about things like shared services, so things like patient registries or provider registries. These are enabling systems that provide the basis of core pieces of information, no matter what the particular eHealth system might be used to facilitate. We need reliable networks. We need things like secure data centers. We have to have an information technology architectures that are reliable and replicable, meaning that the way we design how our networks are structured, how our applications are structured, how our applications are able to communicate with each other is a challenging process, and it does not necessarily need to be done country by country in a unique way. There are models, I think, that can be replicated across the sub-regions. And we need to be able to cost-effectively procure and sustain these information systems and technologies, and that, of course, is a very big challenge. There's many countries certainly have begun the investment process in these various different types of information systems on their own. There's some coordination among some countries, certainly within the OECS countries I know, in terms of being able to share procurement and share information systems, but I think it's rather limited, and I think this is one of the larger opportunities, certainly within at least sub-regions or even sub-regions, if you can call them that, to work more collaboratively and share the costs of those particular infrastructure and application resources, as well as be able to get better economies of scale. It's very difficult, especially in very small countries, to negotiate with information system vendors to get the best deal when you're only dealing with potentially 1,000 or 1,500 users in a country. If there's an opportunity to move that to a larger negotiating body, it certainly would be more cost effective in terms of procurement, but also more cost effective in terms of long-term maintenance. There are certainly systems in the region right now that support support information on the sub-regional level. Certainly Lab is one of them, but we don't yet see those being fully interoperable with systems that are at the local or national level. In terms of, again, opportunities and moving forward, I think there's a real opportunity here for countries to begin to work together to procure and secure applications and systems in a common way, such that they are not having to do all this alone. While every country and every even local area has its unique requirements, generally countries within the sub-regions are trying to achieve some of exactly the same things. And there really is a real opportunity here to save money and to get better costing and to reduce the cost of long-term sustainability by partnering and working more collaboratively in terms of developing and acquiring these systems, but also being able to support these systems. So the cost, for instance, of developing a data center is very expensive, particularly as we look at issues of security and reliability and availability. And to be able to have to replicate those types of infrastructures country by country by country, in my view, is not particularly sustainable. And I think we really need to look for opportunities where that can be done in a more shared manner. From the perspective of legislation, policy, and compliance, these are really enabling policies that provide, again, the legal, or the regulatory, or the compliance framework in order for eHealth to be appropriately delivered as a program and as a service. Certainly, there are a huge range of specific policies that need to be in place. I'm not going to go through them all here today, but they really address things like the use of ICT, appropriate use of it, and support of ICT, procurement of ICT, the issues of privacy and security, the issues of things like minimum data sets that need to be collected within particular program areas, the issues of reporting on that data, the issues of the acquisition and management of human resources related to eHealth, and certainly issues related to data quality and compliance to standards. So where are we now? I think many countries have realized the importance of a strong policy framework and are really working toward developing national policies that address some of the challenges. Certainly, PAHO has begun to work and support this, and there is, in fact, a draft framework that's been developed for the Caribbean sub-region to support countries for the development of their national policies. That, I think, is still in draft form, but my understanding is that there are a number of countries that have begun to use even that draft to build up their national policy frameworks. I don't know of any policies that are yet, at this point, really focused at a sub-regional or regional level. And again, I think that's because we really don't have those formal sub-regional governance bodies in place yet. PAHO is also, sorry, I mentioned at the beginning, I was involved in a project that PAHO has developed in terms of a toolkit to help countries develop a core set of national indicators and maintain that core set of national indicators for the long term. So PAHO certainly, again, is part of that regional strategic plan or framework, is trying to work with countries in that region, sub-region, to enable them to develop standards and capacity for supporting quality health core indicators. So again, I think where some opportunities are is to continue to use some of these tools. I think that the tools that PAHO has developed are a good step forward. I think there's several other types of tools to help other areas that we've talked about that are certainly in the works or have been planned and as part of the strategic roadmap. So where available, hopefully countries can begin to use those to share information on their success and provide feedback to strengthen those tools. And also to use some of the regional and sub-regional forums to begin to share experiences around policy, compliance, legislation, and sharing those templates. So again, I think forums like this are an excellent way for technical leadership to begin to share that knowledge, share those experiences, and not have to begin to reinvent the wheel every single time. Finally, the issue of workforce, of course, is very important. eHealth requires a really specific set of skills that are essential in order to be able to develop and sustain an effective eHealth environment. We need people who have special knowledge in health informatics and health information analysis, a whole range of ICT skills. We need people who can design information architectures and technical architectures in order to support eHealth. We need people with strong project management capacity to implement. We need people with change management experience to help us use these new tool sets in better and effective ways. And we need social media experts in terms of being able to use those tool sets to improve communication in public health. Again, I think my experience has been many countries are really struggling to acquire and to sustain the skill sets that they need. A lot of the effort has been focused on IT. I think that's an area of investment in human services that many decision makers at least understand and have worked very hard to mobilize the necessary resources, although I think there's still a huge gap in terms of the availability of resources required. But there are many areas where we haven't really begun to develop the skill set, certainly around health informatics, health information analysis, change management, project management. These are very essential skill areas that are still missing, I think, largely in the region. And we are seeing some of that development at national and sub-regional educational institutions. Certainly, project management has become much stronger over the past 5 to 10 years, but we don't see a lot of the other programs being a part of the standard curriculum in many areas. So again, opportunities here, I think one of the areas is to begin to look at, particularly among smaller countries in the Caribbean region, is to look at the opportunities for sharing certain types of very specialized resource skills, things like health informatics, health analysis, the whole area of network and eHealth architecture, and change management. These are quite rare skills, I would say, and not highly available, and also relatively expensive to maintain and not necessary to maintain at a full-time level. And I think the development of resource pools that can be shared or moved across the region, I think would be very effective. I think the opportunities to actually, within the regions and sub-regions, to begin to build capacity from people who do in fact have that experience. In the region, certainly in the Caribbean region now, we have many countries that have gone through several years of eHealth experience in various areas and have a really strong knowledge and capacity. And to be able to use that knowledge and capacity within the region through mentorships, through internships, through exchange programs, I think is going to be very important, again, to build capacity across the region. And then again, I think it's very important for countries to begin to collaborate with educational and training institutions to really articulate what the long-term need will be, and working with them to build curriculums and programs that are going to be able to meet and sustain that long-term need. So finally, in terms of the way forward, if you think that some of these opportunities for collaboration, resource sharing have merit, how do we begin to move toward those? And I know there are huge challenges and barriers to beginning to collaborate outside of countries, although we have very good forums in the region and sub-region around health to begin to have those discussions. Mobilizing that and translating that into actual shared resources or shared governance certainly is challenging. So I think the first thing that really needs to happen is an ongoing advocacy and education about the need for collaboration and resource sharing in eHealth with decision makers, as well as with the regional and sub-regional leadership. It's sometimes difficult to make that business case, and I think that we need to work as technical folks to educate our decision makers on what those opportunities are and what the needs are and how it's going to help realize the full benefits of eHealth. Again, there are lots of resources out there already and forums exactly like this one, which I think are very, very important, and to leverage and use those as much as possible to develop communication groups, develop relationships in the region, and then to using these forums to advocate for stronger collaborative bodies and governance forums and technical groups. I think that there's a role too, as we begin to engage with various different international agencies and NGOs, to really have the discussion with them about the need for them to work more collaboratively with their partners in the regions and sub-regions. Certainly, I think there's a huge desire to do so. And in my experience with the agencies, they certainly recognize the importance and the need, but it still, I think, has a ways to go. And as, again, technical people who engage with these groups, we can continue to advocate that they also speak with their counterparts and work to coordinate and collaborate with their counterparts in other international agencies to ensure a common approach, a common vision for public health, eHealth and public health, and a common strategy in order to be able to enable some of these building blocks. And then finally, again, what this forum is doing is to begin to and continue to establish and maintain relationships with your technical counterparts in various different countries to be able to share experiences, share knowledge, and share strategies for improving collaboration and coordination and research sharing. So thank you very much. I look forward to some of the further discussion and questions in the next part of the presentation.
Thank you so much, Mr. Doane. That was an excellent presentation. Some of the key words I heard coming out: collaboration, cooperation at the sub-regional level. And I love the way your slides were organized. I think that was very valuable, looking at the need, the current state, and then looking at opportunities. So I think we really got a lot of the context of public health in the Caribbean policy-wise from your presentation, and I'd just like to congratulate you for that presentation. At this time, we have a quick poll question. We want to find out what your career profile is for those persons who are here in the room. You can use the poll, the same one we used earlier, under your name. There is a box with an A in it. So you would choose what is your career profile, whether it's A, health professional, B, academic, C, ICT professional, D, media, communication, and E, other. And for other, we might also surmise that you might be more than one of those categories at a time. You might be a health professional and academic, or a health ICT professional. So for other, we are assuming also that it could be a mix. So we're just giving a few moments for those who haven't been able to answer the poll yet. And also, please feel free to use the chat to let us know exactly what your job title is or what area you work in as well. Well, for the chat, put your specific title. If you're going to vote A, B, C, or D, use the poll above. Thank you, and welcome to those joining us at this time. We're currently doing a polling exercise. Yes, I agree, Dr. Cortino. It's very interesting to see that we actually have the most E's so far, and I'd like to invite those who have E's to let us know in the chat what it is that you do. Put your career. Okay, I see CARPHA, Caribbean Public Health Agency. They do pharmaceutical quality control. Okay, very interesting. Let us know what it is that you do. I'm going to let you know what I do. Okay, epidemiologist, program manager, management. Great. Okay, because this is an opportunity for us to get to know each other, and feel free to like us on Facebook, Twitter, we're on LinkedIn. We'd like to get to know you as well. So Olivia says I'm trained in health informatics. Someone says, oh gosh, I'm getting so many at one time. Librarian and knowledge management. That's Angela from Guyana. Great. So awesome. So at this time, we want to move on to our